The objectives of lead poisoning. You should be familiar with the sources of lead and the toxicity of lead. Please master the symptoms of lead poisoning and the treatments for lead poisoning. Let's move to the first one, sources of lead. For quite a long time, researchers they are focused on the lead poisoning because lead has effect on children's brain development. The children exposed to different types of lead and different sources of lead, the industry and toys and the polluted water. So the lead concentrate in children's body got a high level and it will damage the children's brain. Then they will have brain problem and nerve system problem. And later we find the lead has wide distribution. You can find it in our daily life. The lead is usually found in the oak with zinc, silver, and copper. So you will see these different stones. They all have lead. So the primary production of lead is from lead oaks. So lead mining is dangerous for the workers. The top lead production countries in 2008, you will see lead production countries is quite wide in the whole world, including Australia, China, US, Peru, Canada, Mexico. So you can find lead production countries everywhere. And nowadays, the largest use for lead is storage batteries, especially the lead acid battery. You can find the lead acid battery in your e-bike. So, manufacturers of storage batteries is a secondary lead production. You also can find the lead as a pigment, and that is why the painting, dyes, printing ink, rubber, and so on, they used lead to be an element for their different productions. The lead has color. You will find the yellow color and the red color. That is why we use the lead as a painting stuff. Now, we talk about the toxicity of the lead. When people exposed to lead, the lead dust can go through inside the body from respirator. After it goes inside, majority of them can expel from respiratory because the size is big. But the small size can stay in our body. There will be 30% to 50% in blood. And immediately you will see this 30% to 50% in the blood. In total, our 99% of them will stay with erythrocyte, and 1% will stay in plasma proteins. And after stay with erythrocyte, they will go to different organs, including liver, lung, kidneys, cerebrum. That is for organs. And few weeks later, you will find lead in the bones, hair, and teeth. And they also can discharged with the urine, saliva, and milk. So we can test the patient's urine and saliva or the milk to find out the level of the lead in the patient's body. So from this picture, you will see after respirate of the lead, as soon as possible it will stay in the blood and then go into different organs, but they won't stay for quite a long time because they will go to the bones and hair and teeth. So 95% of the lead distribution is long bones, and you will find 4% in brain, liver, and kidneys. Only 1% will stay in blood. But we still can test the blood to measure the lead concentration in patient's body. So from this picture, we will see from respiration, ingestion, your absorption the lead, and from respiration, they will go to the lungs, and then with the blood to different organs, to the liver, to the kidney, to the spleen, and the colon. And from the injection, they will go to the stomach, and then they all expel from the kidney. They will stay in the long bones for quite a long time, and the majority of them will stay in the long bones. But you also can find some of them in the brain and in the blood. This is the distribution of lead in our body. And for the lead, there's a special thing for distribution. When the lead goes inside, you will find they are in our plasma will be hydrogen phosphate lead. This is hydrogen phosphate lead, and hydrogen phosphate lead is solubility. So the solubility is activated. They can change to the insolubility. So this one will be the inactive. We call it red lead. They stay in the bone, teeth, and hair. Why they can change their types? It depends on the calcium and pH. If the calcium and the pH are high enough, they will move from the solubility to the insolubility. But when a patient with lower calcium, or they are infections, or they feel hungry, or they have fever, this insolubility would change to the solubility. So they will be an activated one. That is why we will find emergency lead poisoning patient in a hospital.